Okay. Ooh, can't get this one right. Wrong. Which of the following is the underlying cause of this patient's hearing loss? Okay. So a 34-year-old woman comes to the physician reporting difficulty in hearing in both ears for the past 3 months. She denies any head trauma, ear infection, or loud noise exposure. On examination, Weber test is lateralized to the right, and Rhine test shows bone conduction greater than air conduction bilaterally. An audiogram confirms the presence of a bilateral hearing loss. Okay. So we did a couple tests. We do have like a bilateral hearing loss. Um, so with the Rhine test, it showed that the bone conduction was greater than the air conduction.
This question is
Not
actually very
necessarily
difficult, by
sure
the
what
way.
that means.
But anyway,
Sorry?
this question is difficult. This is a difficult ENT question for sure. So just so you know, it's called a Renee test, and
Oh,
uh,
it's not right.
yeah, no, it's okay. This is a very ENT specific test, but I just wanted to let you know it's called Renee. But anyways, go ahead.
Oh, thank you. Um, yeah, stuff like this, I really have no idea with.
Okay, pick your best answer, and then I'll kind of go over it with you.
The best one would be otosclerosis, in my opinion,
Okay, good. Why'd you pick otosclerosis?
because how it's said that the bone conduction is greater than air
Okay.
conduction.
Okay, good, good. Okay, good. So sometimes keeping it real simple will allow you to get the answer right. So I'm proud of you for doing that. So let's talk about this a little bit more. Just because I love ENT, right? So let's go a little bit more detailed. I can't have my students missing ENT questions, right? So presbycusis, what do you think this means?
I have no idea.
So hearing loss of old age.
Okay.
Like presby is old age, right? So old age, right? I'm sorry, my handwriting's bad on a laptop and in real life, but old age, right? You're gonna have bilateral sensory hearing loss as you age. So she's 32. That can't be it, right? Meniere's disease. What's Meniere's disease?
I remember seeing that in GI.
GI. Oh, that's a different one. That's a um. I don't know if it's
Something,
called.
something that
It's
was
not.
really similar.
It's spelled very similar. Hold on. Shoot. It's with gastric cancer. Hold on. Let me see.
Yeah, I can probably find it.
Gastric cancer and
That sounds French.
yeah, let me see. No, hold on. It's called gastric cancer it's a French word. It starts with an M too, but it's not Meniere's disease. It's called shoot. Anyways, I can't think of it off the top of my head, but I know what you're talking about, but that's not the same. Meniere's disease, okay, in ENT world, right? Obviously it's a French word, but Meniere's disease, um another name for it, which they won't test you on it, is um hydrops of the ears, right? Otic hydrops, right? Just means that there's pressure, right? Fluid pressure in the ear system, to keep it real simple, right? Usually the symptoms, right, of Meniere's disease is vertigo,
Mm-hmm.
vertigo that lasts usually hours. Okay, it lasts hours, so the room is actually spinning for hours, and episodic hearing loss that is episodic. So usually when you get these dizzy spells, patients will complain that they can't hear out of one ear completely. But yeah, those are your classic signs of Meniere symptom. Otosclerosis. Otosclerosis, also Meniere's, but they both have like family histories. Otosclerosis, what ends up happening is, so let's see if I can draw this here. Here's your ear, right? Here's your canal. Okay, here's your tympanic membrane, right? You have your three ossicles, one, two, and I draw three here. Okay, otosclerosis happens because the stapes foot plate, right, kind of cements itself, right, onto the oval window so that you can't really push. And over time, it can actually, cause your bones, your ossicles or your ear bones to kind of glue together. So they're not
Mm-hmm.
they're not vibrating well, right? So you're gonna have conductive hearing loss. Okay. And I can't remember the percentage, but a lot of these patients will have bilateral that will happen in both ears, not one, and they'll have a family history. So this is going to be your best answer here for sure. So she's a younger woman, right? Usually it's younger people, right? Younger woman with bilateral conductive hearing loss, right, is going to be otosclerosis. That's how the answer is. Acoustic neuroma is going to give you a sensory hearing loss, right? And usually will come with things like, sometimes it can come with like vertigo, asymmetric hearing loss, things like that. But she doesn't have any of these symptoms, right? And noise induced hearing loss is going to have a history of acoustic trauma, right? And so, being close to, a loud gun that went off or an explosion or something like that. So, definitely for sure. Good job. Otosclerosis is your answer here.